Nevada health officials reported that their first human case of avian flu was confirmed today. They say a farm worker was infected with a new strain of the virus after being exposed to cattle at a dairy farm east of Reno. In California, 38 human cases of bird flu, or the H5N1 virus, have been reported since the outbreak in 2024. Nationwide, 16 states have reported cattle herds infected with avian flu, and the spread through poultry has infected more than 156 million birds, leading to the slaughter of many flocks. New York City shut down poultry markets this week to prevent transmission, and the Centers for Disease Control say nationwide there have been 67 cases of human infections. Joining us live on the floor today is Dr. Peter Chin-Hong, professor of infectious diseases at UC San Francisco. Thank you for making time to talk with us.
My pleasure. Thanks for having me on.
Well, there have been cases of people getting infected from animals, but so far we haven't heard of person-to-person spread of avian flu. I'm wondering, why is there so much concern about the bird flu and this particular strain right now?
There's a lot of concern because even though the vast majority of folks haven't gotten ill, there have been a couple of serious illnesses, including one death in Louisiana, one serious case in British Columbia, and that particular type or mutation called D1 was found in Nevada. So I think the fear is that it continues to evolve and it's going to figure out how to get into human bodies more effectively over time.
And we keep hearing about, avian flu. Are there unique symptoms? And are doctors testing here to see if there are any cases in the Bay Area?
Yeah, so there aren't many unique symptoms. It seems like regular flu with headache, muscle aches, and cough and shortness of breath in some people. And so it's very hard to tell just from clinical symptoms alone. But epidemiologic risk, like if you handle a dead bird or a dairy cow worker with illness, would prompt an investigation. But California is taking it a step further because they're looking at all the regular human flu that we're having right now and doing surveillance, even if people didn't come forward with a risk. And that's how they found that child with bird flu in San Francisco recently. It was through this surveillance that they're doing.
And we certainly heard about surveillance in the previous coronavirus pandemic. Let's talk about food and food safety. When it comes to dairy products, milk, eggs, or chicken, what should people do to make sure they're minimizing any risk of catching avian flu?
So we know that chickens and dairy cows are the most infected right now in California. Is kind of the epicenter in the United States because we have so many of these agricultural animals. Starting off with milk, it's probably the riskiest because much of the virus reproduction occurs in the cow's udders. So the milk contains thousands and thousands of virus. And that's why raw milk is becoming increasingly unsafe and unpasteurized milk products. For eggs, because chickens die so quickly, they can't lay the eggs that are infected. That's why eggs are, although in short supply, they are pretty safe to eat, particularly if you cook them. Don't forget, don't feed any raw meat to cats in particular or pets, and no raw milk to any of these pets either, because particularly cats can do really, really poorly and get something that looks like rabies. It's a neurological disease with bird flu.
And we did see at least one instance recently of a cat getting avian flu. One question in terms of the vaccine, because we understand that California has made some 5,000 doses of the seasonal flu vaccine available for people who work in those farming industries. Does this year's regular seasonal flu vaccine give any protection to someone who might be exposed to avian flu?
It doesn't protect against avian flu on the surface, but because avian flu is just waiting for a chance to get in our bodies. And the way it does it is by exchanging genes with whatever it's around. So if somebody, say a dairy worker, gets infected with both avian flu, which is easy to get right now for that population, and human flu, those two viruses can just transfer genes across. So the avian flu can be like Frankenstein and get mutations that can enter our bodies more effectively, because right now it's having a hard time.
That's interesting. And all of this is coming in the bigger context of a flu season, which the Centers for Disease Control say could be reaching a 15-year high. Why are we seeing this high level of influenza right now in the United States?
That's a great question. I mean, part of it could be the ebb and flow. This is like in a really extreme year for a number of cases. Another reason is that the type of flu that is circulating right now, it's called H3. That's known for causing more serious symptoms, and then symptoms in general. The third reason is that California is it's always late for flu. So particularly in California, we're kind of like trailing in the rest of the countries. So our flu season is just peaking right now. And about 8 in 10 people with sniffles probably have flu in the community.
8 in 10. That is a sobering statistic there, and a good reason to put on a mask or have that handkerchief and wash your hands a lot. Okay. Thank you so much, Dr. Peter Chin Hong from UCSF. We appreciate your taking time today.
Thank you.
Some 2 million